Hi guys, my name is Dr. Iqbal. I'm a board certified internist and have experience in primary care. I wanted to present a very important topic on hair loss. I do get a lot of patients who inquire about losing their hair. So this lecture is important before you go to your primary care doctor, getting started in understanding how hair loss occurs, what is normal, what is abnormal. So a lot of this is basic education and general knowledge that you should know before you come to your primary care doctor so that we can get started on the proper treatment for you. So like I said, this is one of the most common complaints that we often get. There are some hindrances why people cannot get to the conclusion of the hair loss. It could be the lack of understanding by your primary care doctor. It could be just simply not enough time when you go to your primary care doctor. It could be unrealistic expectations by yourself. Or it just could be simply that the patients do not understand. And my suspicion is the last one stands the most chance because this is not something that is taught in our schools, of course. So I think this is something important for everyone to understand what normal hair loss is and what is abnormal before you see your primary care doctor. With that said, let's get started first with understanding what is the normal hair growth pattern. Okay guys, so this is our first slide. Let's try to understand what the normal hair growth cycle is. So as you can see, initially the hair is in the growth phase. So here in the growth phase, you have a blood supply that is going towards your hair and that is nourishing the hair. So initial phase is called the growth phase or the anagen phase, where the hair is being supplied with blood and is growing. Then it transfers itself to a transition phase. The blood supply has been detached in this regards. And finally, it goes into the resting phase or the telogen phase. So here, as you can see, the hair is being pushed up and most likely is going to fall out or shed. So these are the three stages of the hair growth cycle. So in this slide, it's important to understand the different phases and how long do they last. So the scalp hair grows from about 2 to 6 years, and that's the anagen phase. The growth phase, so it varies between people. 2 to 6 years is the norm. The next phase, which is a transition phase, is not that long. It's about 2 to 3 months, which is the catagen phase, and then the shedding phase, which is your telogen phase that we talked about earlier. That's over a period of 3 months. So the longest phase being the growth phase between 2 to 6 years, and then the shedding takes place over a period of 3 months. So what phase are your hair in? In a healthy person, about 85 to 90% of the hair are in the growth phase. So that is a lot of your hair that are in the growth phase. So most hair are in the growing stages. Then 10 to 15% are in that shedding phase where the hair is in the telogen phase and it is more prone to shedding or falling off. So when you see hair coming off, most likely they are in the shedding phase. So what is the normal daily hair loss? The normal hair loss is anywhere between 100 to 200 hairs per day. And it varies by the individual. So some people will lose about 100 and some 150, some maybe 200. So it varies. The hair that grows for a long period of time are the ones that will fall the most easily. So whenever there is higher lengths of your hair, then that they are more susceptible to falling off or having interruption in their growth cycle. The growth rate is about 1 centimeter per month, but there could be many factors that can affect this growth rate as well. So how are these hair being lost? The most common way that the hair is lost is breaking of the hair from the root or the stem cell, which is the root where the nourishment is being provided to the hair. And this is through physical or chemical stress. Infections can be part of it. Inflammation, diseases can be part of it, like thyroid disease. And if you're using medication, a lot of medications can also cause hair loss. The main difference is that destructive causes like physical cause or chemicals, especially hair dyes that are applied, infectious causes or autoimmune diseases, they may end up causing scarring at the hairline. So that is something that has to be identified when you go to your primary care doctor. So there are two different types of hair losses. One that end up producing scars at the area of where the hair growth was, and one that is non-scarring. So here, if you look at the picture, let me put my laser on. If you look at this picture, this is more of an example of a non-scarring sort of a hair loss pattern. And if you look here, you can see some thickening around these areas, and that is a scarring pattern of hair loss. So we will try to go deeper into some of the illnesses and some of the drugs that do end up causing hair loss, and why it is important for you to understand the difference between these two types of hair loss, because one can end up causing permanent hair loss, which is the scarring pattern, and one can be regenerated or the hair can come back, so that can be helped. So here we're going to talk about why can some hairs grow back and some cannot. So in hair loss that is non-scarring, such as the one caused by illnesses. So if, for example, I have thyroid disease, I have Hashimoto's, or I'm under a lot of stress, or I have chronic illnesses like lupus, diabetes, or if I've been using some drugs that are causing my hair to be lost. These are non-scarring causes of hair loss, and here again the hair can has the potential of growing back. But once the illness is brought under control, for example, you stop the drug, then there is a chance for the hair to start growing back. So here you can look at the most common hair loss is obviously non-scarring. Thankfully, we don't have too many hair losses that are experienced as scarring. So most hair loss patterns can be helped. Here you can see a male pattern hair loss, and this picture kind of elicits it a little bit more clearly, where you can see how the hair loss is more symmetric. Let me use my laser. So the hair loss is more symmetric, starting from the front, going backwards, and again starting in the middle as a bald spot and going forward. So this can be progressive and permanent. Where the dark hair, unfortunately, the pigment of the dark hair is being replaced by more lighter hairs. And the causes can be genetic and can be secondary to age. And of course, male hormones play a very important part. One of those hormones is dihydrotestosterone, which stops the growth of scalp hair but ends up promoting the growth of facial hair. So taking testosterone supplements unfortunately converts it to dihydrotestosterone and ends up causing increased baldness. So it's important to understand how testosterone works and why is it important in male pattern baldness as well as female pattern baldness. So we'll discuss that in the next slides. So in the female pattern of hair loss, if you look, it is more diffuse. But they can also have a male pattern hair loss as well. So there could be variation in the females. Usually the main complaint is widening of the part, very common. This is through diffuse loss of the hair and over time becomes bigger, unfortunately. A lot of times, cases can be narrowed down to iron deficiency or thyroid disease, which also kind of causes a similar pattern of hair loss. So when you go to your doctors, it's important they check your iron levels as well as your thyroid levels. Early hair loss, if it is at puberty time, is secondary to a more strong family history. But in older women, which makes the most common patients, the hair loss is more exacerbated when they're close to menopause or reaching menopause or after the age of menopause. So it may be more are susceptible to genetics. It can be a mixed pattern with genes, with hormones, or excess hormones, excess androgens. So that is something to keep in mind when it comes to the female pattern of hair loss. Okay, now we're going to talk about women that have a more male pattern of hair loss. So in the male pattern of hair loss, the women, unfortunately, they are losing their hair similar to when I showed you the picture of the males losing their hair from the front. As you can see, I'm pointing and heading backwards. So there's a receding hairline from the front of the scalp. And also they can also develop a bald spot, and similarly in the males, they are going forward. So this is secondary to excess androgen. So when you go to your doctors, it's important they examine your hair and they look at what pattern of hair loss are you experiencing. Other features should be looked at, such as facial hair growth, as well as cases where there are increased pubic hair growth as well. So body hair growth is something that your doctor should also examine when looking at hair loss patterns. So this is where you also start investigating further. You have to look into diseases such as PCOS. Adrenal tumors can cause increased androgens in the female body. Increased prolactin, so prolactin test is also part of the workup. Also looking at medications, oral contraceptives can end up causing a similar pattern as well. Use of steroids for sure. Anabolic steroids are a major cause of increased androgens in the body. Liver diseases, liver processes a lot of the hormones, is a detox organ. So when that is affected, for sure that is going to end up causing increased testosterone in the body, as increased androgens, ending up causing a male pattern of hair loss. And some cancers are part of it as well. So these need to be looked into and worked up. Does the hair loss result right away? The answer is no. It may take up to 2 to 4 months after the main injury has occurred. For example, you may have had a high fever, you must be sick, and lo and behold, after 2 to 4 months, you start experiencing rapid hair loss. So again, during the time of the insult, the hair may be in the growth phase, and eventually that growth phase can be interrupted, and it may end up going into the telogen phase or the shedding phase, and that can take up to 2 to 4 months. So if you end up stopping a medication that was promoting hair loss, you may not see results right away of that hair loss. You may see increased hair loss 2 to 4 months later, and then eventually hair growth. Keep your expectations realistic. Understand that it takes time for the hair to start growing back. So illnesses, surgeries, medications, such as oral contraceptives, even seasonal changes, you may not see the hair loss right away, but you may see it 2 to 4 months later. What about pregnancy? A lot of people are very happy during pregnancy. The hair is in a nice thick state. It's in the telogen state where it's kind of resting. It's not necessarily shedding, but as soon as postpartum hit, the hair starts shedding, and this may last up to 18 months. So always remember that whenever I see my pregnant patients who come in complaining of hair loss can last up to 18 months. So what is this? Here we have a condition called alopecia areata. Hopefully I'm pronouncing that right. But anyway, this is associated with many autoimmune diseases, kind of a patchy hair loss, if you can see. It is well demarcated. The body is sort of attacking itself. There will be patchy areas of hair loss and rapid hair loss, if you will, but they're well defined. You see if there's a border to it. So that's where you could tell that this may be secondary to autoimmune diseases like vitiligo, which is the loss of your skin pigment, occurs in some African American patients. Hashimoto's thyroiditis, which is the body's attack on the thyroid gland itself. Inflammatory bowel diseases, which is the body attacking, causing inflammation in the gut. That's celiac, ulcerative colitis, Crohn's disease. So these are some of those diseases that can end up causing a pattern like that. So this may be a single event where if you end up getting a thyroid checked and you go on thyroid medication, you kind of stop the offenders from happening. This may stop, or this may be a progressive event where this may end up causing complete baldness in some cases. So it definitely needs to be examined by the primary care physician for sure. And chronic diseases or inflammatory diseases need to be tested in such case. So here you can see diffuse hair thinning. This is a very common pattern in the females, particularly after menopause. And this is where thyroid diseases and diseases such as iron deficiency can end up causing a similar pattern. So the hair loss is not necessarily in any pattern, if you will. It's just everywhere. It just ends up causing hair loss, easy breakage of the hair in a widening part sort of a pattern, if you will. Now, this may be the most boring slide of the whole lecture, but these are all the medications that can end up causing hair loss. You can see that there's a huge list here. This is where your primary care physician will be helpful to you because they can identify perhaps the starting of one of these medications has ended up causing hair loss after a few months. Some of the common medications that people do take are your blood thinners, your Coumadin, your heparins, and then anti-thyroid drugs that suppress the thyroid function per se, such in the case of hyperthyroidism. Beta blockers, which are common medications sometimes used as blood pressure medications, heart medications, of course. Those can end up causing hair loss. So very important you discuss with your doctor if you are on one of these medications or just any medication. Discuss with them if this may end up causing or maybe the cause of your hair loss, if you will. Now here we have scarring alopecia or scarring when it comes to hair loss. This is permanent destruction of the hair follicle, and unfortunately very difficult to have regrowth in this scenario. So you can see how there is development of scar on this gentleman's scalp, and this is after hair loss. There could be many causes where scarring alopecia can be a big problem. Burns, burn injuries, radiation therapy, a lot of time used in cancer treatments. Physical trauma can end up causing it. Hairstyling, forceful braiding or use of tight hair rollers, they can end up causing permanent scarring situation. So in the beginning, again, these can be reversed or can be helped, especially like styling in hair braiding where you're pulling on the hair. It may be reversed, but eventually over time it can end up causing permanent hair loss or scarring development, particularly under the skin where the follicle is, and that makes it very difficult for the hair to grow back. Now, there is a difference between hair loss and hair breakage. So if you look here, there's some short hair, some long hair. This is breaking of the hair. Some hair will break at the proximal portion, especially when it comes to hair straightening, using of heating products. Of course, you don't start all the way here. You may start up, kind of midway and pull your hair straight. And so that ends up causing breakage of the hair. And, the distal part where it breaks will be mostly labeled as split ends. That's where you get your hair cut, of course, keep your ends blunt, if you will, prevent those split ends because that can end up causing hair breakage as the hair tangles easily. So always important to differentiate between hair loss, which is from the root, versus hair breakage, which is breaking of the hair in between. Important thing to identify. So before you go to your doctor, what should you do? You should always collect the evidence of hair loss. How much hair are you losing? On average, like I said, 100 to 200 is within the normal range. It is a tedious process. If you have the time, count it. I'm sure your doctor is not going to count it in their primary care office. They barely have time to sit down with you. So It's important that you count the number of hairs that you are losing. So if it is within the 100 to 200 hairs per day range, everybody varies, it is still considered within that normal range, because your hair could be in that 10 to 15% shedding range where your hair is being lost. However, if you start seeing bald spots, or you're seeing a widening part, that's is a telltale sign that you're experiencing more than normal hair loss. And this will, unfortunately, you can also try doing this experiment where if you have bald areas, you can apply some traction on the side of that area. And if the hair comes off easily, it's an unfortunate sign that there will be increased hair loss in that area. Apart from checking your face, your scalp, you also should look at your face, look at the eyebrows, look at the eyelashes, look at the rest of the body, see if you're also experiencing hair loss in these areas, as well as that could be a more systemic sign, meaning that it could be a more chronic, like inflammatory illness that needs to be worked up. So, can hair growth therapies be successful? Yes, in cases of non-scarring hair loss, which are, like I said, the majority of the hair loss, it can be successful. But your doctor can help you determine best which hair loss are you experiencing. And sometimes biopsy may be needed, particularly if over-the-counter therapies are not working. The most common cause of hair loss is androgen-related hair loss, which means excess androgens. So you'll see that hair loss in that male pattern starting from the front of the scalp. And the second most common cause is systemic illnesses like thyroids, iron deficiency, chronic illnesses such as lupus, rheumatoids, inflammatory bowel diseases. So all of these need to be looked at as well. So when is Rogaine of any benefit? This can be helpful in male pattern baldness, particularly males that are between or before the age of 40, and they have been experiencing hair loss less than 10 years, if you will. A topical solution of 5% minoxidil can be used twice a day. And what it does is actually changes the hair to go from its telogen, which is its shedding phase, to a more growth phase. And that can help keep the hair in a growth state, if you will. It takes at least 6 months before you can start seeing hair growth. So you have to be patient with it. It takes time to see results. As long as the twice daily application is being used, the new hair will persist and they will continue to grow, because remember, you're keeping the hair in a growth state. So they will continue to remain in that phase as long as you are applying the topical treatment. And as soon as you stop applying it, it may take up to 2 to 6 months to start seeing those hair start falling off or shedding off. So as long as you're using it, the hair will stay in a growth phase, if you will. These are some of the other medications that your doctor can prescribe, particularly if the body is in a hyperandrogen state. Finasteride, spironolactone, and dexamethasone. These are all prescription medication, and so your doctor will be the best guide in whether these are going to be helpful or not. Let's talk about female hair loss. So for female hair loss, the FDA has approved minoxidil at 2%. Anything higher than that, and you risk the growth of hair along the facial region, which I'm sure most females don't want that. So initially, starting the treatment may result in hair loss, but you can start noticing less shedding and new hair growth again in 6 to 12 months. So same as males, it takes 6 to 12 months to see results. And like I said, using higher doses may give you better results, but may also give you worse side effects. And for people who do not wish to use medication, they can go with the laser therapy, which is FDA approved and FDA cleared to be used. It can be used as an alternative, or you can also use it in combination with medication. So according to my research, there are different types of laser therapies. There is the hats, and then there are also the combs. So my understanding is the hats are somewhat better. However, both provide results when it comes to hair growth. What can we be doing at home? So for home care, avoid alkaline or pH shampoos that will soften the hair and break the bonds easily, which allows for straightening. Avoid excessive toweling and blow drying. These are just common sense things to avoid. Use a conditioner. This softens the hair to make it easy to brush and prevents from excessive pulling. Combing, such as the white tooth combs, are way better than brushing, and using a natural bristle brush can also help prevent hair from breaking easily. Avoid bleaching, permanent waving, straightening, hot combs, and excessive sun. I want to thank you so much for taking the time to listen to this lecture. Again, this is very important for your knowledge, for you to understand before you go to your primary care doctor, so that you can be more educated in understanding how hair loss occurs and what can be of benefit. Please do visit my website at www.fatimaiqbalmd.com. Besides that, I also have many articles on obesity on primary care topics, and please subscribe to my channel as well as on my website for further information. I want to thank you very much for taking the time to listen and hope you have a nice day.